Hello everyone, it's Dr. Manjiri Nadkarni, Ayurvedic MD, registered holistic nutritionist and base allergy consultant back today for another session of Wellness Wednesdays. So we are in the new year and today's topic is going to be super interesting because I'm going to talk about three holistic tests you need to carry out. You need to prioritize, especially if you are struggling, you have tried everything and you have been unable to find answers, right? So, these are the three tests that I often run in my clinical practice, and they have given me massive results, right? And often, when people are really struggling, they've tried all the blood tests, they've been through their mainstream doctors, they cannot find anything wrong with them. These are the tests that can give me such amazing information, and this information can then tell me that what's exactly going on with the patient's bodies, right? So these are the three tests I'm going to talk about today. If you have any questions, you can post it in the comments below, and I'll be more than happy to answer any questions. If you want to schedule your own holistic test, any of these three tests, please send me a message and I'll be more than happy to chat with you over which one's going to work best for you. So, number one test that you need to prioritize is if you are struggling with digestive issues, right? So, if you are struggling with bloating, gas, constipation, diarrhea, if you are someone who's been diagnosed with diverticulitis, if you are someone who's been diagnosed with um, irritable bowel syndrome, or even inflammatory bowel diseases, if you have Crohn's, if you have colitis, celiac, any digestive issues, this is the number one test you need to be able to go for, and that is a food sensitivity testing. The testing that I use is muscle testing for foods, and food sensitivity testing, especially the one done via muscle testing, is reliable. It's also something where you can find out the daily foods that you're eating and that may not be working well for you, right? So if you are constantly eating a certain food which is not working well for you, that is going to create inflammation in the body. Not all foods are compatible with everyone. There are various reasons for incompatibility. Some could be incompatible because of genetics. We've seen certain allergies, sensitivities running in the family. We've seen certain food combinations together can be incompatible to you. We also see in people who have a lot of gut inflammation, like who have all the symptoms I mentioned, or who have been diagnosed with diverticulitis, who have been struggling with irritable bowel syndrome, who have intestinal permeability, also known as leaky gut syndrome, any of these, they have certain foods that are going to trigger, irritate their digestive tract, which will lead to lots of symptoms. So whether it's nausea, whether it's diarrhea, whether it's constipation, whether it's a lot of abdominal pain, whether it's gas, whether it's bloating, if you have any of these symptoms, you need to figure out what foods are working for your body, what foods are not working for your body, right? This is super important. Keeping a diary helps, but often you can miss one or two foods which may be seen as milder sensitivities, right? And when I do elimination diet with clients, I'll make sure they're eliminating all the foods that are not working for them. So number one test is a muscle test for foods, for food sensitivities, food reactions, food allergies. If you want to schedule your own test, you are most welcome to get in touch with me or Blue Water Nutrition at 519-336-5258, and I'll be more than happy to offer the testing to you. The second test, or rather two tests, second and third test, is for people who are really struggling with weight loss, right? So if you are struggling with weight loss, or if you are struggling with energy levels, right? If you are someone where the weight is not budging, or if you are someone who's also not been able to put on the weight, so anything related to your body weight, the number one test you need to go for is a body composition reading, right? So just weight on the scale is not conclusive, right? It will tell you your total weight, which consist of your body muscle mass. It will consist of all your bones, tendons, ligaments, all the water in your body, the water compartments, as well as the body fat, right? So an example I often give people is, if you are having diarrhea, you may end up losing 2 pounds. If you go through a cold or flu, you may end up losing, 2-3 pounds. Water loss due to diarrhea will still be weight loss. Muscle loss due to any kind of sickness is also going to be seen as weight loss. Fat loss when you're actively working out is also going to be seen as weight loss, right? And I often joke with my clients that chop off your right arm, you are going to lose 10 pounds right away. So these are different kinds of weight loss. The fat loss is the healthier kind of weight loss. Muscle loss is not a healthy kind of weight loss. Water loss from the body, if it's water that's been retained, is a good kind of weight loss. If it's from all your cells, it's not a good kind of weight loss, right? So we need to exactly figure out where we are. You need to place yourself where you are, enable to reach your goal, and that is where a body composition test can help you. A body composition test can also give you lots of data. It tells me about cellular health, how healthy your cells are. It gives me a good idea of your water, intracellular water, extracellular water, which also helps me understand how the electrolytes are functioning in your body. Do you have excess sodium? Do you have lower potassium? So this is some information I can get. And it also tells me about your hydration status. It tells me about your total body water. It also gives me a number called basal metabolic rate. So basal metabolic rate is the amount of calories you need to eat every day to just for your body to function. And from that, we can calculate your daily requirements, right? So the number 2 test that you have to do in the new year is get a body composition test done. Again, I offer this in my clinic. It is not an expensive test. It's just $44 for the testing, but it will give you a lot of information, especially if you are struggling with weight, if you are retaining water, if you feel tired, exhausted. It could be due to muscle loss, which you're not sure about. If you have lost weight or if you have gained weight, this is the number 1 test you should prioritize, right? The number 3rd test is we can do a simple urine test to figure out where your stress gland function is. Again, we are not going into hormonal testing, but this is a very quick, cheap, very effective test which can tell me different stages of stress or what stage of stress is your body under. Is it overactive stress glands? Is it underactive stress glands, right? So are you in the burnout phase or are you in the pre-burnout phase, right? So if you are wired, constantly, then we need to kind of calm things down. And if you are completely exhausted, burned out, then we need to boost your stress glands, right? So these are the 3 tests. So that's the simple urine test. These are 3 basic tests everybody should prioritize in 2025. If you have found no answers, right, to your health issues, to any of the health complaints or challenges you're going through, if mainstream medicine has not been helpful, and if you want to go even deeper than the 3 holistic tests I've talked about, we have fantastic Ayurvedic assessments, which are more assessments over just tests, right? So I can actually assess your tongue, I can assess your pulse, I can assess your entire body using different Ayurvedic assessments to give you a better idea as to where your health is and what's really happening from a bioenergetic level. What is the level or the current situation of doshas or bioenergies in your body, and what are the organs that are weaker, that need a little bit support, what are the organs that are overloaded that we need to take a little load off, right? So these are some things we can find through Ayurvedic pulse readings. We can also find in depth about your digestion. We can find out more about gut dysbiosis. Certain signs are seen on your tongue, and Ayurvedic assessments like pulse, tongue reading, etc. are always used together in a complete initial assessment. So if you are interested in taking your health to the next level, especially in 2025, you can call us at 519-336-5258 to schedule your holistic tests, and you can schedule food sensitivity testing. You can schedule a body composition as well as a urine test to understand your stress levels, right? Or Ayurvedic assessments as well. So thank you for watching. I will be back next week for another session on Wellness Wednesday. Till then, stay healthy, stay happy, stay blessed. I'm going to say a quick hi to Colleen. Thank you for watching. Bye bye.